I'm Susie Ali Hassan, Deputy Director of Commercial and Innovation Team at UCLPartners. Just as a bit of an overview of what we'll do this afternoon, I'll just introduce the fellowship and then ask our executive sponsors from within our partnership, Claire and Paul, to provide some opening remarks. We'll hear from the fellows themselves, and then Libby will provide a bit of an overview of the programme. It's wonderful Chris Lang, our Chief Executive from UCLPartners, is able to join us and close the launch today. So welcome to you all. We're really delighted to be able to launch the fellowship programme today. This programme was created based on an ask from our system leaders and our NHS partners, and will play a critical role in supporting innovators from within the NHS develop their idea and understand a realistic route to market. So I'm going to start with just for those that are slightly less familiar with UCLPartners geography, we are a health innovation ecosystem covering a large population of just over 6 million people, bringing together hospitals, universities, and other NHS providers across our broad population. We work broadly around to support health innovation and improvement across our NHS partners. And we are made up of a number of different organisations which span the innovation pathway. So we're really lucky that we can draw on our academic expertise to support and advise innovators coming from outside our system, but also coming from within our system as well. And we're delighted to be able to draw on some of that support and work throughout the programme and experts to advise the fellows as we start the programme in the next couple of weeks. I'm really lucky to lead the commercial and innovation team at UCLPartners, and our remit is around bridging the gap between new innovation and technology and it being taken up and utilised within the system. So day to day, we work with industry partners and innovators, advising them on the NHS and advising them on mechanisms for access and understanding the market. And it's wonderful that we're able to use that expertise and those skill sets within the team, but also external partners to influence the fellows and help them understand how to make the most of the innovations and the work that they've been doing to date. And as mentioned, we're really lucky that we have some senior executive sponsors for the programme to help guide and steer us and better understand how the system is changing and evolving, and hopefully support the fellows further along their journey. So with that in mind, I'd like to please hand over first to Claire Paniker, Chief Executive of the Mid-South Essex NHS Foundation Trust. I'm going to stop sharing my screen for some opening remarks. Oh, you're on mute, Claire, I think.
Schoolgirl error. Thank you so much, and it's really a great pleasure to be able to be here this afternoon, and more importantly to be able to help support this programme. We've been working to try to support clinical innovators for the last few years at MSE, and obviously, you know, I'm delighted that that's been really successful so far. You know, it is absolutely the case that so many of our staff have got, you know, fantastic ideas, fantastic innovations that really improve care for patients and the working lives of our staff. But so often in the past, I think they've been completely frustrated and bewildered about how you actually get anything to take hold in the NHS. It's a really complex system. There are so many difficulties along the way, and it takes, you know, real determination. So programs like this, I think, are really essential in helping to take something which is proof of concept and try to get it adopted and implemented across the NHS. So I think it's a really wonderful opportunity. It's really motivating for our staff. It's really great for all of our workforce to be able to see that that great things can happen as a result of small ideas. And I think that, you know, we've got lots of challenges. We can't continue to do things in the way that we always have. We have to innovate, and some of the innovations you're going to hear about today, I think, have real opportunity. And you know, they're really some of them are actually quite simple in concept, but it's about how you scale them, how you get them adopted and really mainstream in the NHS, which I think is really exciting and a fantastic opportunity. So delighted to be here. Thank you so much for asking me to help, and I'm really looking forward to hearing from each of our innovators today.
Thank you very much, Claire. And to introduce, please, Paul Calaminas from East London Foundation Trust.
Thank you very much. And to echo Claire in saying what a pleasure it is to be here today and to have been asked to be involved in supporting this programme. I do want to apologise for turning up looking like I've been fighting. I haven't. I played rugby. And I discovered that I'm too old and uncoordinated to actually put it off any longer. As I say, it's a real pleasure to be here. It's a real pleasure to be involved in the programme and to meet the entrepreneurs today. And I think particularly to say that I think through all of our work in East London, so both in Bedfordshire and East London, we've really, I think, over the years come to appreciate the power of innovation, the immense difference that what seem like small changes, but lots of small changes can make to patient care, to people's experience at work, to the way the NHS actually is experienced by everyone who's using it. And so really to emphasise the importance of programmes like this, the importance of what UCLPartners can bring to the whole idea of innovation and really helping to create that culture. Because I do genuinely, very, very genuinely think it's ideas like the ideas we're seeing today and all the other support and permission in a way that programmes like this can give innovators and improvers all across the NHS that in the end are what really, really help us to improve quality and to improve the service we're providing. So really, honestly, it's a pleasure to be here and to be involved in the programme. Thank you.
Thank you so much, Paul. Thanks very much. Right, so on to the main event, and we're delighted to welcome our 5 fellows to the launch event today. This is really exciting, hopefully for them and for us. So please can I introduce Dilshan to start.
Hi there, and thank you very much for the introduction, and thank you for the opportunity to work with UCLPartners. So my name is Dr. Dilshan Arawala, and I'm a consultant in anaesthetics and intensive care at Mid and South Essex NHS Foundation Trust. I've had a long history of involvement with quality improvement, whether it be enhancement of services or new ways of working. And what I see within the NHS is our ability to make change but not sustain them, whereas digital can be an enabler for not only process change but also behaviour change. And as a CCIO, a role I took up about 3 or 4 years ago, I started on a long educational journey with a master's and an MBA and multiple other courses, which has now landed me as a founder of a product called UCLPartners. And if I want to kind of sum up what UCLPartners does, I ask you to look at Apple versus the NHS. Both are at the cutting edge of their industries, both employ a similar number of people. And when people say, I've got a job at Apple, they think about the future and about all the opportunities that they have. And sadly, within the NHS, that is less of the case these days. And what UCLPartners does is to address some of the structural barriers that exist within the NHS that prevents that from happening. And using digital as an enabler of interventions, we use data science with a behavioural science framework to do several things. And the first thing is to build a relationship between staff and the organisation, for the organisation to showcase what it has on offer, where the learning opportunities are, for staff to progress their careers, work with purpose, depending on where they are on their own professional and personal pathways. In the short term, we have proven already that we can put the right person in the right place with the right skills at the right time. In the longer term, what we will have is a sustainable, upskilled and functionally flexible workforce. Do we have evidence of success? Yes, we do, with the product in its first version. We're about to launch a much wider pilot with MSC, testing out a lot of new features, which is co-sponsored by NHSI. Do we have other evidence of success? You may have heard of the UCLPartners Care Delivery Platform that's been used across the east of England by 500,000 users, and importantly 20,000 MSC staff for flu, vaccine and PCR and so forth. So thank you very much for the opportunity. I look forward to working with you all, and I'm sure we can make a success of this.
Thank you very much, Dilshan. You're very welcome. Lola, please would you like to join us?
So hello everyone, my name is Lola Adigan. I'm one of the fellows. So can everyone hear me first of all? It seems to have frozen.
Yeah, we can. Yeah.
We can, brilliant. Thank you for the opportunity. So my innovation is called Know to Nip It, and it's an innovation that is a reporting and case management tool that helps organisations to resolve issues such as bullying and harassment, patient safety concerns, unfair treatment, and a whole range of other workplace challenges. So my background is in HR. I'm one of the HR business partners at MSc, and prior to joining MSc, I worked at Barts Health Trust, and my passion's always been in employee relations. So my app is around supporting employees to raise workplace concerns, and it can help the NHS because the staff survey last year showed that 13% of staff did not feel safe to speak up about things that concern them at work. And it also highlighted a culture of bullying and harassment in the NHS. So 12% of employees experience bullying and harassment from a manager, and 19% experience such behaviour from a colleague. And the problem is, without a proper communication channel, it can be difficult to speak up. So my innovation is an app which helps employees to raise workplace concerns with the option of anonymity. And it can help the NHS in the sense that it can help to reduce sickness absence caused by stress and anxiety, because a lot of workplace concerns cause employees to go off with work-related stress. Turnover, because again, staff can, they tend to resign or look for other jobs if they're not happy at work. Bank and agency spend, because it will help organisations to cut back on using agency and bank staff to backfill staff that may have gone off with work-related stress or have left the trust. And also with employment tribunal cases, because hopefully it will nip concerns in the bud before they escalate into formal complaints and grievances in employment tribunals. I'm hoping to, in terms of my experience in the fellowship, I'm hoping to access mentoring and build my networks and look at how to take my app into the marketplace.
Thank you very much, Lola. Wonderful. Right, Michael, please take the mic, so to speak.
Hi everyone, I'm Mike. I'm Head of Mental Health Law at Barnet, Enfield and Haringey Mental Health Trust, and I chair a network for people who do my kind of job as well. Since 2013, I've been developing an access database which I called Sidekick. It's a tool for Mental Health Act administration and governance. I'll give you a very brief illustration of what I mean by that. The Mental Health Act in a hospital setting operates by granting powers and imposing duties on hospital boards. Boards then set out in a scheme of delegation which members of staff are authorised to exercise each particular function on their behalf. Now, most of the powers and duties are exercised by clinical staff, e.g. Dr. X must fill in Form Y by date Z, but there are also a range of duties that tend to be delegated to administrative staff. All mental health hospitals or trusts have a mental health law department, or at the very least, a Mental Health Act office, a Mental Health Act administrator. And their role is to discharge the administrative functions of the Act, but also to make sure that all of the clinicians know what is expected of them. So all your clinicians know what to do and when. No main patient record system has ever done the Mental Health Act very well, and after 16 years of trying, I'm beginning to believe none of them ever will. Even very basic statistical returns on the Mental Health Act from the likes of Rio and Care Notes are notoriously unreliable, and they contain little, if any, tools or functionality to make the process of administering the Act easier. So Mental Health Act offices up and down the land have to run parallel systems so that they know what's going on. And usually those parallel systems are lots of spreadsheets. Sometimes they're still in the realms of paper ledgers, whiteboards, that kind of thing. I mean, really sort of prehistoric stuff. And the idea of Sidekick is it replaces all of that with a single standalone database solution that can tell everybody what they need to do and when, that can make the process of administering the Act easier by writing, sending and filing all your letters and emails for you. And it provides a reporting suite which will enable your governance committees to get a good and sort of robust understanding of the operation of the Act. So it's been implemented in my trust for some time, and I'm very pleased to be part of the programme with the goal of turning it into something that could realistically be scaled and used in other organisations. So quite niche really compared to what I've heard from everyone else.
Yes, wonderful though, wonderful nonetheless, and we'll certainly we certainly have an interest in mental health in our commercial innovation team as well, so that's great. Okay, please, Naveen.
Thanks, Susie. Hi everyone, I'm Naveen. A brief background about myself. I'm an orthopedic registrar. I'm originally from India, moved into the UK to work in NHS 15 years ago. Been in the system ever since. The problems over this period, particularly over the last 6 to 7 years, I observed is what everyone has seen: staff shortages. We have significant staff shortages, and that causes almost £6.5 billion every year, and advertise posts up to 90,000 jobs in NHS. Particularly, doctor shortages is almost to the tune of 12 to 15,000, including the GPs. There is no temporary fix to it. It's a permanent solution, which essentially is to train ourselves, but we do not have the infrastructures, and it's a long-standing process. A temp fix to that remains to identify and recruit doctors like me, who originally have moved from overseas. But that process, again, is very laborious, and it's not so easy. We built a system. The solution to this problem, essentially the cost staff shortages and efficient overseas recruitment, we kind of found a solution. The innovation is called Doctor UK. It's been launched and working. We recruited into Chelsea Westminster Hospital and Princess Alexandra, most recently in Harlow. It's very ethical. What we have done is like identify doctors like us who could work in the system and build a platform where ideally the idea of joining the innovation program is like we could work seamlessly with the HR departments. So in a way that what traditionally could take up to 4 to 6 months to do one effective recruitment, doctor or nurse, could be done essentially in less than 2 months. It's safe, validates and vets every single CV or the new staff recruited, and brings them together into the picture very quickly and in a very super cost-effective way to the NHS, while we as a background will support and provide the pastoral care to the new recruit. I'm looking forward to work with the teams and then learn from the other fellows as well, and enhance and provide the service to multiple trusts. Thanks for the opportunity again.
Thank you very much, Naveen. Thank you. Pradeep, can we please welcome you?
Yes. Hello, can you hear me okay?
Yeah, you're a little quiet, but you can maybe...
Okay, I'll try to speak up. So hi everyone, my name is Pradeep. I'm a GP by background, and I just want to say thank you to UCLPartners for this opportunity. So a little bit about myself and our product. So our product is called Care IQ, and what we are trying to do is to try and improve the management of chronic health conditions in primary care initially, but hopefully moving into secondary care in the future as well. So a few years ago, when I started working as a GP partner, what I realized was the way in which we manage our patients with chronic health conditions in terms of recalling, reviewing them, identifying our high-risk patients was a little bit haphazard. And I've worked in many different practices, and there's no one standard approach to how we manage what is essentially a large bulk of our work. And what the current system involves is essentially running searches on our electronic medical health record system, which then gives us spreadsheets of patients that we have to then manually recall, contact, get our admin staff to book them in for appointments for reviews. This, as you can imagine, is very time consuming, takes up a lot of not just administrative work, but also clinical time as well. So what Care IQ is aiming to do is to make this process a lot more efficient. And we essentially have two products. One is a dashboard which clinicians can use, and we've developed it so it's not just to be used by GPs. It can be used by nurses, healthcare assistants, physicians associates, clinical pharmacists, because we know now with all these new roles coming into general practice, it's very important to include the entire team. And the product essentially allows you to search by condition for different patients, prioritize your patients, so try and identify those who are at the highest risk, and invite them in for recalls. We have a built-in communication system as well, which can send text to the patients, contact them as well. And we have bulk texting features as well, where if you are looking at all your patients with hypertension or high blood pressure, for example, you could send them out a bulk text to invite them in for reviews and invites. Another thing that we're working on is a patient app as well. So this will enable patients with chronic health conditions to stay on top of their condition, so they know when their last blood pressure was, what it was. I'm just using blood pressure as an example, but we're trying to cover all of the chronic conditions that we have to deal with in primary care. But it helps them stay on top of their condition, understand what medications they're on, why they take it, and it helps us notify them directly if they need to come in for reviews and other things too. Another thing that we're looking at is, apart from just looking at sort of the pharmaceutical treatment of chronic health conditions, we're working with health coaches, so to try and enable patients to make more positive lifestyle changes. So part of the features that the app will offer is signposting patients to services within the NHS and kind of community services that can maybe help them lose weight and promote better lifestyle changes. So those are the kind of things that we're working on. We've run a pilot at a practice, and we're scaling up to run a few more pilots in the next few months, covering about 40,000 patients. And the kind of support we're looking for is with commercialization of the product and scaling up as well. Thank you.
Thank you so much, Pradeep. I think you might win points for the most relevant background as you were speaking there. Please can I welcome Libby Graham, who's the UCLP Innovation Programme Programme Manager, to just tell you all a little bit about the programme and inform those on the call today.
Thanks, Susie, and thanks again to everyone for joining us today. If we haven't met before, my name is Libby. I'm the Programme Manager for the Fellowship. I'm really excited to have you all here today, and thank you to our wonderful fellows for those introductions. We are excited to have you on board and part of the UCLPartners family. So I just wanted to give you a bit of a background as to what the fellowship entails and what the fellows can expect over the next 12 months as part of the fellowship. So we are, as Susie mentioned earlier, lucky enough to draw on a wide range of expertise from within our UCLPartners core team across our 6 research and innovation designations, and as well as close delivery partners that we work with within the health innovation ecosystem. So we are delivering this as an in-house fellowship innovation with support from those delivery partners. And I'm just going to show you a little bit about what the fellows will be doing as part of their journey. So the fellowship will be divided into 3 core parts. The first 4 months they'll focus on building a robust evidence generation plan, really important for when they're making conversations with NHS trusts outside of their own. The stage 2 will look at business development. So as Pradeep mentioned, commercialization support where fellows would like that, as well as developing a robust business case and value proposition to the NHS. Stage 3, for the final part of the fellowship, will look more in towards the implementation, developing an implementation plan and considering all the things that go into that in terms of things like information governance, human factors, those kinds of things. So yeah, I hope that sounds like an interesting programme, interwoven with all of these general workshops that the fellows will be part of together. They'll have one-to-one mentorship from experts within our team and from across our delivery partners as well to support that evidence generation and market to scaling up. So really nice to see you all today, and I'm going to pass back to Susie.
Yeah. Thank you so much, Libby, and thank you for all your hard work bringing that all together. So it was lovely to hear from all our fellows, and we're excited hopefully to have you together in person. Well, when we have our first kickoff session next week, but for a more sort of halfway point really of the programme, perhaps sometime in summer, we can bring you all together and have a real audience. That would be wonderful. So and hear your progress perhaps at that point. That would be great. So I'm going to hand over now to Chris Lang, our Chief Executive Officer, just to close and give his thoughts really on the fellowship and the start of the programme today.
Great, thanks very much, Susie. I'm phoning in also from a clinical environment in what might be my last on call in the Royal Free Hospital, but lovely to see you all, and congratulations to our fellows. It's fantastic to see this programme up and running, and interesting to see some of the themes emerge that are very much on our minds in the health and care system around workforce, mental health, chronic disease management, etc. And it'd be very interesting to hear more about your stories in time, about how you conceived and developed these ideas. But we're of course thinking about next steps and helping you develop into innovators that can scale these projects more widely across the UCLPartners footprint. So it's a new program. I think it will develop. I think it might get bigger. Sorry, Susie and Libby, but I hope in time this is something that we can scale, and something we're committed to putting some resource into and very excited about. I'd just like to conclude by thanking Claire and Paul for the significant amount of time and enthusiasm they've put into being our executive sponsors. A note to Amanda Begley, no longer a director in UCLPartners, but was very much by supporting Susie and Libby and getting this going. I'm something of a Johnny come lately to this, but obviously very supportive. And of course, Susie and Libby for all the hard work they're putting into this programme and hosting a good launch event. So thank you. And we're keen to get feedback from the fellows as to how this works and what more we can do. We're linked to some of the other fellowship programmes. Of course, we host the NIE, and we'd like to connect you with some of those other programmes over time as well. So do let us know how it goes and what we can do to develop this over time. And thank you, Susie.
Yeah, thank you very much, Chris. So that was a sort of short and sweet showcase really of the fellows. We just wanted a formal way to introduce them to you all, and really happy to begin the programme. Long time in fruition now, and so delighted to start the programme next Tuesday. Thank you all for your time. Thank you, yes, Paul and Claire and Chris for joining at the end of your shift there. Wonderful to see you all, and we'll keep you all posted.